Welcome to the Beat. My name's Peter Birch. We're here at Hlth Europe 2024. I'm joined by Richard Stubbs, Chair of the Hlth Innovation Network. Hey Richard, how you going?
Hi Pete.
It's great to have you here. I've been excited about this. I'm really keen to learn more. I've seen from a distance about the Hlth Innovation Network. What is it? Tell me a little bit more about why it exists.
So the Hlth Innovation Network is a network across England, the entirety of England. It's made up of 15 separate organisations. The reason it's there is because we have to accelerate the adoption of innovation, in the NHS in particular. We are great at invention. We have world-leading academics, clinicians, researchers, innovators, coming up with all manner of things about how you transform the way you deliver care. But if that doesn't happen everywhere, then you're not going to get the full benefit. So our job isn't to do the research. It isn't to get into the ideas set stage. It is to work with the innovators, work with the NHS and think, here's a great thing that's proven and evaluated. Every single patient in the country needs to be able to benefit from that. And while doing that, we're helping our innovators to grow. We're helping to create jobs for our local economy, and good jobs equals good health as well.
Yeah, right. No, I think that's great that there's a lot of focus on that messy middle part, between the two important key stakeholders, and that's where often in that translation piece of taking an idea to execution, it falls down. So what are some of those activities that you're performing with either of those stakeholders to get them from that point of an innovative idea into real life?
Yeah, and a lot of it feels like, you get yourself in the middle of, the NHS and innovators. It feels sometimes as a job that you're kind of a translation service, because everyone's coming into this thinking, what I want to do for patients. The NHS wants to do it for patients, our innovators want to do it for patients, but sometimes they just miss each other. So with the innovation side, a lot of this is about helping them to navigate the NHS. It's an incredibly complicated place. There's a lot of front doors to knock on. If you're an SME in particular, that's a lot of shoe leather and a lot of coffee. So how can we help them to have bigger, better conversations at a place level, a regional level, sometimes a national level, so they can have a single conversation. But at the same time, how can we help them to get better at their own value proposition? Talk in a language that the NHS understands. If you're going to sit there in front of a medical director, a nursing director, yes, you want to talk about cash releasing savings, and yes, you want to talk about efficiency, but really, you want to talk about how does this help clinical staff, how does it help patient benefit? Those are the kind of numbers and the metrics that the NHS needs to hear. So how do you help innovators learn the language of the NHS? From the NHS's point of view, how do we help them to become better signalers of their demand? Because actually, when I started this job 10 years ago, the NHS didn't broadcast well its needs. And so innovators were kind of coming to our virtual front door saying, have you got a problem that fits this solution? We need to get better at saying, these are our pain points. These are our priority areas. We need help on CVD. We need help on elective backlogs. We need help on prevention and well-being. We need to send that signal out there so that people start working on the stuff that we actually want.
Yeah, that makes a lot of sense that, it's obviously the NHS or different parts of the system are going to have different needs at different times, and to be able to get the most out of that arrangement that fits well. What are some, and you touched on a few examples of those before. I saw that just recently you were up on a stage, and this point around health equity was a big focus for you. Is there a role for innovators to play in kind of enabling some of this health equity? Is that why that was an
Yeah, I think it's massive. It's absolutely massive. We had a great talk. We were on the main stage here on Tuesday. Some amazing, phenomenal international speakers. I was moderating it. They made my job very easy because they just had to just say, off you go, be clever for 40 minutes. But the conversation was really about, there's almost I think on the stage they described this as a crossroads. We could really mess up if we think about tech and innovation within the context of the current infrastructure. So if we just digitalize current ways of delivering care, we are going to bake in the inequalities that already exist. So we're going to exacerbate health inequalities if we just carry on doing things the way we've always done, but doing them digitally. Conversely, there is a way that tech can be a huge beneficiary agent to better health equity. But you've got to think about that from the outset. So you've got to think about the digital divide. You've got to think about how we reach communities who have worse access to data, worse access to devices, worse access to confidential spaces. There is no point putting digital-first pathways out there if the communities that they're aimed at are the very communities who can't access them. These aren't insurmountable problems, but they are barriers that are going to really put us in a bad place unless we think about them. So health equity, health inequalities, and tech, huge opportunity, but also I think some major challenges if we get it wrong.
Yeah, and to be fair, it can be difficult to build solutions that kind of fit for everybody, and sometimes it's like, well, let's build that to suit the majority so that then, we can work on the rest. But sometimes in healthcare, those that need the most amount of care are in that kind of the bottom end. So in terms of how you might suggest to innovators or anyone within the health ecosystem to really kind of address the needs of health equity, particularly to those that might be of, as you mentioned before, in those communities of need, or perhaps even the diverse communities that would require particular attention.
And I think you've got to think very carefully about those groups of people and think about, we talk a lot of things, I think about pathways, as if pathways has to be a single pathway that everybody has to walk down. And actually I think more and more, we saw this in the pandemic, there is something about the fact that, for starters, face-to-face care will never go away. Yeah. But actually, how does digital therefore become a way that we can take away a huge proportion of the population who are comfortable with digital pathways? And therefore, we're freeing up resources. We're freeing up face-to-face resources at a healthcare provider level for those people who need that face-to-face support. So there's definitely something about, it's not, everybody doesn't have to fit in the same box. I think when you are thinking about tech and innovation that is aimed at reducing health equity, you've got to think about the research. You've got to think about how we've got this wrong in the past. We did so much work on pulse oximetry in the pandemic, and it turns out that pulse oximetry is pretty useless when it comes to people with black skin. How did a product like that get so far down the pipeline from a research point of view without recognizing that it was unfit for a huge amount of our population? So innovators have got to look to examples like that. They've got to think about what are their population cohorts that they're using to test and research on. These days, nearly everything has an AI component. How do you make sure that AI isn't being built with inherent biases? We've seen things like the use of medical textbooks and things like that, which over the decades have had inherent bias in that's only just really being realized. How do we make sure AI doesn't go down that same path?
Yeah.
But ultimately, to be honest, it's the same message that you give them and would have given them over the last few years. It's you've got to put the patient in the center. You've got to think about all patients. And you can't just build something for only one fraction of society. Yeah,
that constant remains for sure. Hey, here at Health Europe, there'd be innovators from all over the world and within Europe that would be interested in providing their services into the UK. Is the common pathway to go through the Health Innovation Network?
Yeah, it is. There's we have so many single front doors in the NHS. We could have an entire street of single front doors, but it's not the only route in, but it's definitely a good route in. There are so many fantastic organizations as well as the Health Innovation Network in the UK. So we've got a really well-resourced National Institute for Health Research. So it depends on what stage innovators are at. But certainly if they're at the point where they are in the market, in their home countries, they have a product or a pathway change that's being used, it's being evaluated, it's got real-world data, then the Health Innovation Network is absolutely the place to come and talk to us. And if we're not the right conversation, we'll get you to the right conversation, because we're all about trying to reduce your friction when it comes to how you do business with the NHS. And then the next question is obviously, well, which Health Innovation Network? There's 15 across the country. To be honest, it doesn't really matter. They're all amazing. They do some great stuff. We work as a single national organization together, so the 15 of us meet, talk, have a governance that covers all of us. If you touch upon the wrong one, if you knock on the wrong door, we'll get you to the right door. But ultimately, check out the website, Health Innovation Network. Find your local Health Innovation Network and start there.
Yeah, amazing. Hey, as we're wrapping up Health Europe 2024, lots of key takeaways and insights and new names and faces and connecting with some old ones too. Any kind of key things you're taking away back to the UK to share with others?
Yeah, apart from an amazing unicorn walking around with a sparkly jacket, which is, that is my key takeaway. I think innovation is a team sport, and you can see that on the floor here. You can see that in all the conversations that happens. Innovation isn't led by one part of the healthcare system. It needs the innovators, it needs business, it needs life sciences, It needs our healthcare providers and our leaders and our clinicians and our academics. You've got all those people here at Health, so the conversation is really rich. And you need all those players on the pitch if we're going to really get the benefits of innovation felt globally.
So true. Richard, that's all the time we've got on the beat. Thank you so much.
Cheers, Pete.